Have you ever imagined how you'd react if you found yourself in a survival situation? Would you know how to administer first aid? Picture this. You're out in the wilderness, miles away from civilization. Suddenly a mishap occurs, an injury, a sudden illness. You're alone, or with others who are looking to you for help. In these moments, it's not just your survival instincts that come into play, it's your knowledge and skills, particularly in first aid, that can make a critical difference. First aid is not just about dealing with minor cuts and scrapes. It's about knowing how to respond to serious injuries, how to perform potentially life-saving procedures, and how to keep someone stable until help arrives. It's about understanding the human body, how it reacts to trauma, and what you can do to help. In survival situations, danger is always lurking, and accidents can happen in the blink of an eye. Knowing how to administer first aid could mean the difference between life and death. In survival situations, even small cuts or scrapes can become serious if not treated promptly and properly. Treating cuts, scrapes, and wounds is a skill that could be the difference between life and death. First, you'll want to gently clean the wound. Use clean water and mild soap if available. This helps to remove any dirt or debris that may have gotten into the wound and could cause an infection. Next, it's time to apply an antiseptic. This can be something like hydrogen peroxide or rubbing alcohol if you've got it. If you're in a survival situation without access to these, you can use a clean cloth soaked in boiled water. The goal here is to kill any bacteria that could cause an infection. Once the wound is clean and treated with antiseptic, you'll want to dress it. This means covering the wound with a sterile bandage or cloth. This will protect the wound from further contamination and help to speed up the healing process. Throughout this process, remember to keep everything as clean as possible. Infection is a serious risk with any wound, and it's even more dangerous in a survival situation where medical help may not be readily available. One more thing, if the wound is deep, bleeds excessively, or doesn't stop bleeding after 10 minutes of direct pressure, it's serious. Seek professional medical help immediately, if at all possible. Remember, a small wound can lead to a life-threatening infection if not addressed correctly. When someone's heart stops, every second counts. Do you know how to perform CPR? CPR, short for cardiopulmonary resuscitation, is a life-saving procedure that can make all the difference between life and death. It's a skill that everyone should have in their survival toolkit. First, let's talk about the steps involved in performing CPR. Remember, this is not a substitute for professional training, but a quick refresher or introduction. Step 1, ensure the area is safe. You can't help if you become a victim yourself. Step 2, check if the person is responsive. Shake their shoulder and ask loudly, "Are you okay?" If there's no response, yell for help. Step 3, check for breathing. If the person isn't breathing or is gasping for air, it's time to start CPR. Step 4, call for medical help. If you're alone, do this before you start compressions. If someone else is around, have them call while you begin CPR. Step 5, start chest compressions. Kneel by the person's side, place the heel of one hand on the center of their chest, then place the other hand on top. Push hard and fast, about 100 to 120 times per minute. Step 6, give rescue breaths. After 30 compressions, give 2 rescue breaths. Tilt the person's head back slightly, pinch the nose closed, and breathe into the mouth until you see the chest rise. Repeat the cycle of 30 compressions and 2 rescue breaths until help arrives or the person shows signs of life. Remember, acting swiftly and calmly can make all the difference. Panic can cloud judgment, so it's essential to keep a level head. In a survival situation where medical help may not be immediately available, knowing how to perform CPR could mean the difference between life and death. CPR can restart a heart and buy precious time until professional help arrives. So equip yourself with this knowledge. It's a skill that's priceless and one you'll hopefully never have to use, but if the need arises, you'll be ready. A fall, a slip, an unexpected twist can lead to a sprain or fracture. Do you know how to handle it? In the wild, a mishap as minor as a misstep can lead to a sprain or a more severe fracture. It's crucial that we understand how to identify and treat these injuries. A sprain typically presents with pain, swelling, and bruising around a joint, often making it difficult to move. Fractures, on the other hand, are more severe. They can be suspected if there's an abnormal bend, intense pain, swelling, and sometimes an audible snap or grinding noise at the time of injury. Once you've identified a sprain or fracture, the first step is to immobilize the injury. This is where splints and bandages come in. Splinting is a method used to keep an injured body part from moving, reducing pain and preventing further damage. You can use items like sticks, boards, or even rolled-up newspapers as makeshift splints in a pinch. For sprains, compressing the area with a bandage and elevating it can help reduce swelling. Remember, the goal is to immobilize, not cut off circulation, so ensure the bandage is firm, but not too tight. Fractures need immediate medical attention, but if you're far from help, splinting the broken bone and keeping the person calm and comfortable can prevent further harm. Properly treating a fracture or sprain can minimize damage and accelerate recovery. Shock is a silent killer in emergency situations. Do you know the signs? Let's delve into the world of shock and understand how we can recognize and address it effectively. Shock is the body's reaction to a sudden drop in blood flow, leading to a decrease in oxygen supply to our organs. Its signs can be subtle yet deadly, making it crucial to identify them early. A person in shock may exhibit cold and sweaty skin, a weak but rapid pulse, irregular heart rate, rapid breathing, dizziness, fainting, or even changes in mental status like confusion or agitation. If you suspect that someone is in shock, the first step is to call for medical help if possible. While waiting for help, try to improve the person's blood flow. Have them lay down and elevate their feet about 12 inches, unless this causes pain or further injury. If possible, turn them onto their side if they are likely to vomit, to prevent choking. Next, keep them warm and comfortable. Use blankets or coats, whatever is available, to help maintain their body heat. Try to keep them calm and reassured. If they're conscious, you might consider giving them a small amount of water to sip. However, if they're unconscious or nauseated, avoid giving them anything to eat or drink. Remember, every second counts when dealing with shock. Recognizing the signs and acting swiftly could mean the difference between life and death. Recognizing and treating shock quickly can save a life. Serious wounds may need more than a bandage. Can you administer basic wound closure? Picture this. You're far from medical aid and dealing with a deep cut. What do? You might need to close that wound yourself. Let's talk about stitches and staples, two basic wound closure techniques. Stitches or sutures are typically used for deep, narrow wounds. They pull the skin together, promoting healing and reducing scarring. Staples, on the other hand, are for wide, shallow wounds. They're faster to apply than stitches and can be especially useful in high-stress situations. Remember, these techniques should be last resorts. They require sterile equipment and a steady hand. Improper use can lead to infection or worsen the wound. But in a survival scenario, you might not have a choice. Knowing how to stitch or staple a wound could save a life. Proper wound closure can prevent infection and speed up the healing process. Burns and scalds are common injuries in survival scenarios. Do you know how to treat them? In the heat of the moment, it's crucial to stay calm and take swift, sure steps. For minor burns, cool the area gently under running water for at least 10 minutes. Never use ice or icy water, as it can further damage the skin. Once cooled, cover the burn with a clean, non-stick dressing to protect it from infection. Now let's talk about major burns. These are deep, cause white or charred skin, and are often larger than the size of the person's hand. Major burns need immediate medical attention. Until help arrives, try to make the person comfortable and watch for signs of shock. Don't attempt to cool major burns, as it could lead to hypothermia. Remember, the right burn treatment can prevent infection, reduce pain, and promote healing. Proper burn treatment can prevent infection and promote healing. Sometimes you won't have a first aid kit handy. Can you improvise? In the face of adversity, everyday items can become life-saving tools. A clean cloth or bandana can serve as a bandage or tourniquet. Duct tape can secure a makeshift splint or seal a wound. A credit card can scrape away a bee sting. Even your cell phone can light your way or signal for help. Never underestimate your surroundings. In a survival situation, ingenuity is just as important as knowledge. First aid skills are a crucial part of any survival toolkit. We've covered everything from treating wounds, mastering CPR, and handling fractures, to dealing with shock, wound closure, burns, and improvising tools. These are more than skills, they're lifelines. Remember, in the face of adversity, your knowledge and preparation can make all the difference. Be ready, stay safe, stay prepared, and remember, first aid is a life or death situation. If you found this video helpful, please like, share, and subscribe. Make sure you click the bell to get all our notifications.